everybody. That's us, Cameron, myself, Dr. J, Joey, and Chris. We're back. Change the channel now. Otherwise, jump in because we're going to take a little ride on Cameron. Something different's going on here. Camouflage. No, it's a haircut, right? New haircut. What you got? What's going on different with you today? What is that thing hanging from your arm there? Let's talk about it.
Yeah.
You have surgery, brother.
Yeah.
Uh-oh.
What's today? Wednesday? So Thursday. So 6 days ago.
Well, it could have been worse, man. At least they left it on.
Mm-hmm.
So this was that, what was it? A labrum tear, wasn't it?
Torn labrum. They came in right before and marked it up. He said, which one are we doing? And I was like, well, at least he's marking it. Because I was thinking, there was a story one time about somebody getting a arm amputated or leg, and they did the wrong one.
So let me tell you the story about that. I joke about that all the time whenever I accidentally put, like, say, if I'm putting a therapy on, a non-invasive therapy on a patient on one side, and I go, oh, they say, doc, it's the other side. I go, well, thank God I'm not a surgeon, right? So I know this is the way I understand the story. They used to put an X on the let's say it was your right shoulder. They put an X on there, and that was supposed to mean X marks the spot. Well, some doctors apparently thought X meant, no, not that one. So
he signed it. He put his name on it.
They do. So now they put the name on it. They have you agree that we're working on a left shoulder.
Yep, they did
right?
that,
And
yeah.
you signed that. Yeah,
they asked me 5 times, actually. The nurse asked me, the other nurse asked me, and then the doctor asked me,
That's
which
good.
one are we working on?
That's
I was
good.
like, y'all don't remember? It's left, you guys.
They're covering their butts when it comes. Actually, that's got that's a case of live and learn. And somebody else, thank goodness, not you. But go on. So let's talk about this, because we had the surgery. I mean, you had the surgery. Not me. Thank you very much. But I injured mine again in the gym a couple 3 weeks ago. And what I found interesting, because with you, we knew you were going in, and what I've always found is surgeons don't have a post-op healing protocol. And that's always sort of, because there's a lot of people don't know that there's actually things you can do to increase the rate of that recovery, and also to reduce some of the scar tissue associated with the surgery, right? And being that this is the surgeon's money-making forte, why don't they? And again, we have to look back at their curriculum doesn't include anything natural, really.
It's also what they can bill. You know what I mean?
And exactly, they can't bill, I guess, for the protocol that that we use and have used for quite some time.
Yeah, and
I want to talk about that a little bit today. Things that people can do post-op and actually pre-op as well. There's certain supplements that will help with that recovery process and reduce that chance of inflammation and infection, key point, during that surgery, right? Or from that surgery. So what do you say we go over that? Because I know you and we spoke about that. You were going under and you said, hey, again, what's the protocol?
Yeah, it was actually Wednesday, a week ago, because we were recording.
Mm-hmm.
And I said, hey, what do I need to take? And you had me write it down. I ordered it. Standard Process got it to me literally Friday. I ordered it Wednesday and it got to me Friday, which is crazy because it was just standard shipping from Wisconsin.
Yeah.
And it got there in 2 days. So.
And this is another great thing about this company. They actually have, they have a protocol that's designed for, for people who have surgery, post-surgery and also, prior to. One of the key components always prior to anything that you can do to increase that healing rate, the recovery of connective tissue, which again, great place to start. Think vitamin C. Anything that increases collagen formation as well is going to help, right? So with that, we put you on a product called Cataplex ACP. Now again, let me make sure that I clarify, people. This is not ascorbic acid. We're not talking about 500,000, 2,000 milligrams of ascorbic acid. It's not going to do the the same thing, because it is not the vitamin C whole food complex with the P factor in it that we talked about to help with the circulation, increasing blood flow. It's got to be organic to get it done, right? So that was one we put on, one we started with. And again, the other big thing for me is chlorophyll. Because with chlorophyll, again, I've got the powerful antioxidants. I've got the vitamin E in there. I've got the vitamin F, help with the calcium absorption to the tissue. I've got the blood building protocol, but we didn't want to start with the chlorophyll. So prior to the surgery, because they had a clotting factor in there, right? Vitamin K. So we held that one off until after the surgery. Now, so we have some all right? The other great anti-inflammatory is your fish oil or your polyunsaturated fatty acid. But then again, because that can increase blood flow, we recommend that after post-op, right? What was that other great herb from MediHerb?
Oh,
Goto Cola.
Goto Cola, yeah. That, and there's oh yeah, and Ligoplex 1.
Now, of course, and then the minerals, all right, to help with the connective tissue as well, increase the elasticity within the connective tissue. And that's where I move in with Goto Cola, because, for example, your surgery, right, when we're going to have scar tissue from the surgery. And this is where a lot of the complications occur post-op. I had a patient who was in, it's funny when we have these things, it seems like it was just yesterday or the day before, but Bob's about a 70, so what is he, probably 73, 74-year-old male. And he sent me a copy of the most recent MRI, and he has an issue with the left leg and into his low back. And what the MRI shows is that he's got some scar tissue formation from the surgery that he had a few years ago. Now, and I explained this to Bob, it's the same thing that his neurologist explained to him as well when I was mentioning this to him. A lot of times after a surgery, they'll come out and their symptoms are significantly reduced. They feel great, right? And they consider that, okay, a successful surgery. Go downstream about a year or two, and now the scar tissue formation starts to increase and the fibrosis associated with it and the inflammation resulting from that. And now he gets his symptoms back again. So it's already been considered a successful surgery because they documented it that way. Now he's got the scar tissue. Well, what can you do with the scar tissue? You really can't go in there and shave it down because it's a natural event that occurs within the connective tissue, right? So chances are we'd have more. So now he's got to find some kind of protocol that reduces the scar tissue. That's what's great about Goto Cola. This herb is known for that. Let me read a little bit for you on it. So, promotes healing, Goto Cola. This has been around a long time. A lot of my buddies and people who are familiar with injuries, especially scar tissue formation type injuries, are familiar with this. And you started using this. Promotes healing and regeneration of internal and external damaged, injured, and inflamed tissue throughout the body. Useful after all surgeries and in the healing and preventing of conditions involved or related to the following: skin, again, bones, adhesions, and fibrosis, which is one of the major complications that most post-op people have, right? Which we're going to eliminate with you in the healing and prevention of those conditions. So, diabetic neuropathy, on and on. And so here we go with something we can do internally to help recovery and help improve the post-op issues from occurring like they did in my patient that I was telling you about that had the surgery on the low back. So with you too, the other big thing is anything that increases that fibroblastic activity, which is like the Grostic stuff that
Could
we
that
do.
help that patient you had?
Yes, well, but now,
deep internal?
okay, because it's now we're looking a little deeper. So now he's using a new form of some sort of like an ultrasound, almost where we're using a sound wave to go in there and try to break it up.
Therapy,
yeah, shockwave, and this is it's somewhat new. So this is what his neurologist is attempting to do. With me, I would either use ultrasound, but I'm going here with the Goto Cola, right? That's what I can do internally to help reduce this scar tissue and inflammation. And then the other things we talked about, that's what I love about the chlorophyll. And chlorophyll is going to build the blood, right? So if I'm building blood, remember I need that circulation for that healing.
Yeah, because labrum's a specific
carrying oxygen into the area. Oxygen in vitamin C, vitamin E increases that. The vitamin E is found in the chlorophyll. Follow how all this works. So, and like I always said, when it comes to healing, any modality that I can use to increase the what is it again? I was just talking about fibrinogen. No, not the fibrinogen, but that increases the blood flow into that particular area, the faster that I'm going to be able to get the healing process, right? So cross friction massage like we were talking about with the
grass, right?
or even massage itself, deep as you can go in to help the healing process, right? So reduce the fibrosing that occurs, increase the range of motion. Because with you now, you got your post-op, you're going to the PT, and you're working on range of motion, correct? Well, if I want to increase and maximize that range of motion, I need to decrease as much fibrotic scarring as I possibly can. I like to use this analogy sometimes. Think of a pair of pantyhose, right? Post-surgery here on you, that connective tissue. If I had a pair of pantyhose and I was to sew a piece of leather into that pantyhose, all right, when I go and stretch that pantyhose, like I'd be stretching that ligament or that tendon, where it inserts into that panty with that leather, what am I going to get there? I'm going to get continued tearing until I increase the elasticity in that area. And that's where that cross-friction massage helps. Because the word I was looking for is fibroblast. Anything that you can do, whatever therapy brings the most fibroblasts into the area is going to increase the rate of the healing the fastest. That's what I found over my 30 plus years in this business. So with you, that's where you're going. And we're going to use you as a guinea pig kind of to find out how quickly you recover.
Yeah, that's what I'm curious about, because that's like someone else was like they were able to get back to, like, obviously they're not their weight room numbers or nothing like that.
Be careful there.
Full recovery in the sense of like they can start doing everything after 6 weeks. And I was like, okay, well, I'm doing everything they're doing, plus I'm adding in this other stuff. So.
It helps to be fit before you go into any surgery. That's why a lot of surgeons won't do knee surgery and hip surgery until overweight people really drop a lot of weight, right? So you're going in, but this is where you got to watch yourself, because you, like me, all right, like going in and like pushing yourself, like the exercise, but this is where sometimes the outcome is not as good for those who push themselves a little too fast and a little too hard, which is sort of like your MO, if you will, or that's sort of the way we roll. So I'm gonna go easy. How long are you in the sling for?
Well, they said 4 weeks, and then if I leave the house, 6 weeks. So if I'm inside, only up to 4 weeks. But I mean,
that's a long time for you, dude.
I know. I feel like
ADD.
I feel like 4 weeks will be fine for everything, but we'll see. You know, the surgeon, when I see him Friday, he may be like, "Oh, you look great. We'll move this up," because he said he doesn't fully know until surgery, and so maybe he's waiting until like Friday to tell me exactly what.
And follow him. Listen, you
and the PT has. Gets
and he might be amazed how quickly you get there with some of these products, and then make sure you pass it on to him, just so that he has an idea. Systemic enzymes are another great product. We'll talk about that another day. What was I going to say on this one, though? Again, labrum tear. Tell people what it was we dealt with. I like to say we, right, brother? Sorry. Okay, that you're dealing with. So labrum tear, no tendon damage done, no supraspinatus involvement.
No, none of that. Just torn labrum, and I got pictures of it, print offs they gave me of it, and you can see a pretty decent sized tear on it.
Did he wind up taking that tear out? Was it chipped out? Was there a fragment? Or I think you said he didn't remove that, right?
No, because a lot of times, once you're like over 35 or whatever, this is what happened to my buddy. My buddy had a torn rotator cuff and then some fraying or some other stuff going on with another rotator cuff, and they just cleaned it up and scraped it, but then they had to staple back another rotator cuff, and then his labrum was torn, but they didn't even repair it. They just said, you're 33, 34, whatever, we're just going to go ahead and move that biceps tendon somewhere else. But I'm kind of confused what all they did with me. I know they repaired the labrum, but I'm not sure if they moved the biceps tendon or not, because my PT said they did, but Mom didn't remember the surgeon saying
and you'll get
that.
this from the follow-up.
So Friday I'll know a lot more.
Yeah. Good.
But before I go into like what?
When it's too late.
When it's done. Well, here with the labrum tear, because this is a common, labrum tears are common with, you see these in like baseball players, outfielders who dive for balls with outstretched arm, or fall with an outstretched arm. So how did you wind up? Do you know how you wind up? Or is this cumulative stuff over time?
It was just over time.
Some people can fall on the shoulder and do that.
Yeah, it was over time.
Because the shoulder is a very shallow socket. It has to be, because we need all this range of motion, right? So the labrum is like, I use the term sort of like cartilaginous, kind of like the chicken gristle on the chicken leg, right? It gives us a little bit deeper socket for a little more stability. But this is a form of tissue that it can tear easily and break off and chip off, and that's typically when you have that chip floating around. You got a kink in the joint, if you will.
Yeah,
and for a lot of people, they just lose that range of motion. They have to go in and take that fragmentation out. Yours was not that severe, but
I did feel there was impingement though, and I'd get like right here, I could feel it. And then in PT, he was like just moving me around yesterday, and I didn't feel that, even though it's not fully healed, I just didn't feel the impingement. Yeah. So that's great. But I'd say probably like 26 now, probably when I was like 20, I started feeling like just a little bit of something when I would do like side raises or whatever with just dumbbells, and I just felt a little bit of something, and then eventually started feeling a little bit of something when I would do like the pec deck or
some of your favorite exercises.
Yeah, stuff I did all the time, and then it started off with I didn't do any overhead press or shoulder press, and then it got to the point where I wasn't doing any shoulder exercises. Then it was like, okay, now I'm not doing a lot of chest exercises, and part of that was I started doing jiu-jitsu, and I only was able to do it for like 3-4 months, and then all of a sudden it was like, dang, my shoulder hurts pretty bad. Man. So then I went and got the MRI, and they're like, yeah, it's torn.
So the jiu-jitsu had to be an exacerbator, because most everybody, and my patients that are fighters or wrestlers or whatever you want to call it, grappling on the mat, shoulders are a big thing for that, the major thing, right? Because you're using, like I said, you're taking the body weight and from out of the hole the maximum amount of pressure on it. So, well, dude, let's see how this works out.
Yeah, how long? That was another thing. How long do I need to be taking that stuff? Because my normal stack is fish oil and all this other stuff, but the Godu-Kola and the chlorophyll. How long do I need to be taking those?
I like a 60-day protocol. 2 months, right? Okay. See how it moves at follow-up, right? When you follow up, find out how things are healing. But again, a lot of times with this, you can't see inside. You can only go with what's feeling on the outside. Yeah. That chlorophyll is also a great, not only anti-inflammatory, but also helps with pain, decreasing pain as well. Matter of fact, remember when I injured this right shoulder 3 weeks ago at the gym? All right, I injured again that supraspinatus. Where it was crossing through the joint, and I got to where I couldn't bring my arm up. Now, in order to abduct the arm, I was having to incorporate the traps, the scalenes, and all this up into the side of my neck, which wound up hitting that trigeminal nerve, which was giving me a tingling pain sensation in the top of the head. The middle branch was into my inner ear, so I was getting some inner ear discomfort, and the lower branch was in my jaw, and so I was feeling that in the jaw. I took a couple of these chlorophyll, because these are great for things like dry socket, with patients with dry socket, to knock the pain out and also to help with the healing. magical. So what I did is I took a couple of these chlorophyll capsules and I put them in the right side of my mouth and I chewed them up and let that sit in there for a couple of 3 to 4 minutes. And then I just washed it down because it's chlorophyll. So therefore you get green teeth, right? So I washed it down, dude, it knocked that pain right out for 3 or 4 hours. And it increased the rate of healing. Then of course I got it adjusted, upper cervical adjustment, C2 into the trigeminal nerve. And my massage therapist was able to get in there and work those muscles down and take a lot of the spasm out of there. So for about 2 days, though, I was symptomatic. Not fun.
I have a ton of that Ligaplex 1 at the house, and then I have a good bit of the ACP, but I'm going to have to order up the chlorophyll and go to cola because I think I accidentally got the small bottle because, it automatically puts the small bottle on there. So you just hit cart. You have to go in and edit it if you want the larger bottle. So I'll have to go and order those again. But the Ligaplex 1, for some reason, we have like tons of it. Mom accidentally ordered a bunch of it. So I've been taking, like you said, 3 at each meal.
And that Ligaplex 1 is for injury. Ligaplex 2 is for preventing injury, right? That's more for like professional athletes, and it's actually as well has a very good multivitamin in it. But Ligaplex 1 for healing that acute soft tissue injury. And here again, like I said, 30, 60 days. Because even with you, dude, I would rather overkill and get complete healing as opposed to, just going with the symptoms and cutting it out early.
Yeah.
You're a very active person, very aggressive person. Let's make sure we feed. That's the other thing. This is just food. Most of this is just food that we're feeding to our bodies. And again, like I said before, we talked about, 50 years ago, you didn't have hip and knee replacements. This is an example. This is the kind of food that we're missing in our diets daily. Not enough green leafy vegetables, not enough vitamin C in our diets, right? Too much ascorbic acid being taken with synthetic, which is actually decreasing our vitamin C reserves in our body. Follow me. Synthetic B vitamins doing the same thing to our real B vitamins that we need. So basically some of these synthetic vitamins are depleting our body from these nutrients that we need. And that's why you see all these hip replacements, connective tissue injuries as well. So feed it until we find our perfect diet and we're eating these daily consumption within our food places, which most of us aren't doing. So hopefully that was something that was beneficial to everyone today. Know that there is something you can do to increase that rate of recovery and that you should do to make your body heal faster. And also too, anytime we're talking about infection associated with these surgeries, vitamin C, great place to start. Chlorophyll for preventing the infection in the first place. So, brother, good luck with that. In the meantime, stay consciously aware of your awareness. And everybody, don't forget to have yourself a great day.
So you ain't missing one.
There you go. Till next time.